Welcome everyone to the Parrot Club's July 2025 meeting. I'm Amy Hopkins, president of the club, and tonight we're going to be talking about avian ganglioneuritis, also more commonly known as PDD, and we're very happy to have Dr. Raina Schunk with us here tonight. Dr. Schunk is a 2013 graduate of the Cornell University School of Veterinary Medicine. After obtaining a veterinary degree, Dr. Schunk completed a one-year exotic animal internship and two-year residency at South Wilton Veterinary Group here in Connecticut, achieving board certification in avian medicine and surgery in 2018. She stayed on as a clinician at South Wilton, where she sees birds and other exotic pets. Dr. Schunk enjoys teaching, and she's given veterinary continuing education lectures for traveling vet retreats, educational presentations at the Stamford Museum and Nature Center Exotic Animal Care Conference, and teaches guest lectures in avian medicine to the veterinary students at Texas Tech University. She shares her home with 4 cats and a very ornery Quaker parrot. So I'm very happy to welcome Dr. Schunk here tonight, and I will turn it over to her now.
All right. So I have the chat in the corner, so I'll try to keep my eye on it and see if people chat in, but if I miss you, we'll go over questions at the end, so don't feel forgotten. So the first thing you'll probably notice is that the name of the lecture isn't proventricular dilatation disease or PDD. This disease has gone through a lot of nomenclature changes, but this is the one people have settled on for now, because proventricular dilatation isn't the only sign that we can see with this disease process. So let's see if there we go. So just as an overview, kind of a little history, it was first reported in the 1970s and called macaw wasting disease because it seemed to most commonly affect macaws, and there was really no other sign except this sudden loss of weight, loss of condition. And like I said, it's gone through many names, so if you're looking at older papers or older references, you might see myenteric ganglioneuritis or lymphoplasmacytic ganglioneuritis or splenic neuropathy, but AG or avian ganglioneuritis is what we're using currently. And it's been identified in over 80 species of psittacine and some non-psittacine birds, but the most common species we see it in are African greys, macaws, and Amazons. So the causative agent, we think, was identified as a novel bornavirus in 2008, but much of what we know about bornavirus has evolved in recent years and is probably going to continue to evolve as more research is being done. So in this lecture, I kind of broke it down by what do we kind of traditionally think of as PDD, bornavirus, avian ganglioneuritis, and then why are those things possibly wrong or have we elaborated on them as more data has come out? So kind of the points we'll go through are that the disease is characterized by maldigestion, regurgitation, and weight loss. The symptoms are caused by inflammation in the peripheral nerves, like the nerves of the extremities and the body, rather than like the brain and the spinal cord. That bornavirus is the causative agent, and all the affected birds with this syndrome should have bornavirus. That the disease is horizontally transmitted, like bird to bird, by the fecal-oral route, like exposure to feces or secretions and ingesting those or breathing them in. That the best method of diagnosis is crop biopsy, and that the only treatment options are NSAIDs. So this is all the stuff we're going to kind of throw out, and we'll go over why. So, as far as is it a maldigestion syndrome only, the most commonly recognized form of ganglioneuritis does involve inflammation of the nerves innervating the GI tract. So we see atrophy of those smooth muscles that control motion in the gut, that kind of back and forth motion of ingesta between the muscular ventriculus and the smooth muscled proventriculus. So the proventriculus becomes very weak and thin-walled, and that allows it to expand, hence proventricular dilation. And that results in a maldigestion syndrome. They have weight loss, regurgitation, undigested food and droppings, because at its most basic form, this is affecting their GI motility. So this is just kind of a necropsy image of what a kind of PDD stomach looks like. And I think I can get a pointer on here. If I can do it quickly, then I'll try. And if not, I'm not going to waste too long trying. No, you'll just have to take my word for it. So in the figure E, you can see the round circular muscular ventriculus, and then coming right off the top, like a little apostrophe, is the smaller proventriculus. And then in figure D, you can see a very dilated proventriculus that has become so thin-walled that you can actually see the GI contents through the wall of the proventriculus. But what we're now learning is it is not only a maldigestion syndrome. And some more common things we're seeing are ataxia or uncoordination, lameness or weakness, seizures, blindness, even heart issues. It seems like this can affect the conduction of impulses through the heart muscle. So sometimes these birds have arrhythmias or are more prone to heart issues. And then still debated, but possibly playing a role in feather destructive behavior. So this could be mediated by damage that the virus causes within the spinal cord. Still not really enough evidence at this time to say yes or no. Or some people think it could cause like neuropathic pain or tingling, something that sets the animal onto kind of paying more abnormal attention to its skin. So this is the scientific stuff that we'll kind of just blow through. But so as far as the traditional PDD diagnosis, that is caused by inflammation of the enteric nerves, like the nerves that innervate the gut. But there is probably a lot more going on than just, oh, those nerves are compromised. It's probably not that they're just being damaged. It's probably that the inhibitory nerves, like the nerves that say relax, are not functioning, and that leads to the isthmus, that little pinched area between the proventriculus and the ventriculus, kind of staying overly pinched shut, and that's kind of causing food to back up in the proventriculus. But that doesn't really explain a lot of the clinical signs that we see outside the GI tract, like seizures and blindness and leg weakness. So this is just an example of that proventricular dilation on radiographs. The arrows are pointing to, well, the first two arrows are pointing to the very enlarged proventriculus. And then that third arrow by the left marker is pointing to the ventriculus. But in a normal x-ray, you really should barely, if at all, be able to see the proventriculus. So even seeing it kind of tells us that there is something going on. So as far as just the inflammation of the peripheral nerves, that's not all that's going on here. We are seeing lesions not just in the peripheral nervous system, but in the central nervous system too. And what those lesions are kind of influence the course of the disease. So if we see perivascular cuffing, which is basically inflammation around the blood vessels in the brain, an injury of the glial cells, like the glue cells in the brain, that can cause seizures. If we have lesions in the optic lobe of the brain, that can cause blindness. If we have lesions in the cerebellum, which controls our balance, that can cause ataxia or intention tremors. And intention tremors are, I don't know if you guys have ever seen those cats that have had a viral infection when they are in the womb and they come out and they are very wobbly. It's basically not having that inhibition or control from the cerebellum and making overly exaggerated, uncontrolled movements that then they kind of have to bounce back from. So the virus might actually start in the periphery, like in the vagus nerve, which is kind of the main innervator of the gut, and then ascend to the brain. Because histologically, like on biopsy, a lot of the tissues that we see affected, that we find bornavirus in, are innervated by the vagus nerve. So the gut, the adrenal gland, the heart, the kidneys, those are all kind of touched by the vagus nerve. So that could be one of our main points of infection. So the second thing we'll kind of go through as a maybe yes, maybe no, is bornavirus as the causative agent. So bornavirus was isolated from affected birds in 2008. The preferred nomenclature now is psittacine bornavirus because it's not just bird avian bornavirus. There are other bornaviruses in other types of birds, other families that are not psittacine. So the type 2 and type 4 are the most commonly reported in parrots, but there are several other types both in parrots and in other birds. The virus replicates in the nuclei of nerve cells, and it's what we call a non-cytopathic infection. So it doesn't actually kill the cells. It's not rupturing the cells, it's not damaging them. But what happens is our white blood cells kind of come in and try and fight this virus, this non-normal thing, and that's where we get a lot of that inflammation, that invasion of lymphocytes and plasma cells that cause a lot of the lesions that we see. So, again, as bornavirus is the causative agent, we should see bornavirus in all affected birds, right? But we don't. And not all birds that test positive for bornavirus ever develop ganglioneuritis or PDD-like signs. So, as far as bornavirus being the only causative agent, it's likely that there are other factors at play. Not that bornavirus isn't involved, but there may be other things that are needed to make it cause illness. So, some people think that could be an autoimmune response to brain gangliosides. So, if you've ever heard of testing anti-ganglioside antibody or AGA, there is a correlation between antibodies to their own gangliosides in their bodies and whether or not they develop clinical signs. So, if you find in the blood antibodies against their own brain antigens, then that could be a sign that they're more likely to develop actual clinical signs of PDD. Some of the disease might be immune mediated, and that could explain why some birds are negative for bornavirus. If something besides bornavirus in those birds is triggering that same type of immune response. So that could also explain the asymptomatic carriers. They might have the virus, but not have that immune response. So we kind of have to have two things, it seems, an immune response plus or minus a virus, and some may have one but not the other. Some, very few, but some kind of prominent vets in our field don't even think bornavirus is related to the disease at all. And that's mainly just one guy, Dr. Scott Eccles, who runs lots of microangiogram CTs. That's kind of his thing, is working on very, very precise imaging. And he thinks most of the signs that we see, at least in the GI form of PDD, are actually from atherosclerosis of the celiac artery, or the main artery of the gut. So he's sort of on the periphery of, what most people believe, but he's at all these lectures, giving education. And so it shows that not everyone in our field is agreed on kind of what the path of this disease even is. So as far as going into now, how is it transmitted? Is it transmitted directly, horizontally, so from bird to bird? That was kind of what we thought. We thought that it's shed in fecal secretions and in respiratory, like oral secretions, so it should be able to be transmitted through those. If it's in the poop and another bird is exposed to the poop, then it should be able to be transmitted in that way. But when we tried to actually infect birds in that way, when they tried studies and basically fed birds bornavirus infected tissues, they did not seroconvert. They didn't actually develop antibodies against bornavirus. They didn't test positive for bornavirus in their blood. So there may, again, be other factors at play in transmission. So are there other factors that are needed? There was one study that showed that for birds with wounds, they were actually able to transmit bornavirus back and forth. So does it need to enter the bloodstream? Is there an issue with immune compromise? Do we need a weakened immune system when the bird is exposed in order to allow the virus to get a foothold? Is there a second virus or a second organism at play, and co-infection with those two things is required for disease? These are all questions at this point, but again, it shows we don't have it all figured out. So just kind of illustrating horizontal versus vertical transmission for those that aren't epidemiologists. But horizontal transmission is basically, 1-to-1. We sneeze on someone, we give them our virus. That's horizontal transmission. Vertical transmission is transmission to the next generation. So an infected host passes it on to their offspring. So that in mammals can be, through the placenta or through milk, and in birds, that's through yolk and egg material. So the idea of vertical transmission is gaining acceptance. Bornavirus is found in the brain and yolk of embryos from affected parents. So if the parents are bornavirus positive, then their yolk and embryo test positive too. Other studies kind of contradict that. They showed that if you take the chicks away from bornavirus positive birds and hand rear them, then they don't have bornavirus. So, as with horizontal transmission, there are probably other things at play that we have not figured out yet. It does seem that birds that were infected at a young age, so infected as babies, vertically transmit the virus more easily than birds that got it as adults. So, if they get it at a young age, they're much more likely at maturity to pass it on to their offspring than birds that got it as adults. Why? Don't ask me. Don't know yet. So as far as diagnostics, oh, and I do see a question about in a home where you have like maybe a bornavirus positive and negative bird, and we'll go into that a little later, so I don't want you to think we're ignoring that, but it is later on in the lecture. So From a veterinary standpoint, if we're looking to diagnose avian ganglioneuritis, we want to look for that dilated proventriculus and slow GI transit, at least in the GI form of the disease. And for that, we might need contrast radiographs, like X-rays with barium, to see that proventriculus and ventriculus on radiographs. If we have CT available, even better, but not every doctor has that available. I myself don't, and it tends to be much more expensive. On our blood work, we might show increased muscle enzymes because the disease is damaging the muscle of the gut. But other than that, there aren't really any specific common changes that we see on blood work. Crop biopsy was once considered the gold standard for diagnosis. You'd put these birds under anesthesia, snip out a little bit of the crop, trying to get at least a little blood vessel in the crop because we know that this virus tends to cause inflammation around blood vessels. But now we know that about 24% of those are false negatives. So in 1/4 of affected birds, we're missing it on a crop biopsy. And we're taking a big risk putting these birds under anesthesia when they may be unstable, thin. We know that some of them have cardiac complications. If your biopsy doesn't happen to have a nerve in that section, you're going to miss it. And we're not going to get any of those birds that have lesions only in the central nervous system, so like the non-GI birds. So crop biopsy has really fallen out of favor as a diagnostic approach to these guys. So what other things can we do? PCR for coronavirus, so like swabs of the mouth and the cloaca to see if we pick up that organism. We can do that on blood as well. Serology, which is basically looking for antibodies, is actually a great diagnostic. Unfortunately, it's really not available in the US. Texas A&M used to run that test. They don't anymore. Apparently, from what I've heard, it's more available in Europe, but it's not widely available as a test right now. Anti-ganglioside antibody, like we talked about, those birds with antibodies against their own brain tissue. Is that something useful in testing? Still a little bit debated. So, ideally, our current diagnostic recommendations, in a perfect world, we would do paired coronavirus PCR and serology. So looking for both the virus itself and antibodies against the virus, which shows us it's not just hanging out in there. The body is making antibodies against it. It is causing an immune response. So many healthy birds we know are coronavirus positive. They're just hanging out. It's not doing anything. So a positive PCR test doesn't mean that the bird's going to develop signs, and it doesn't even 100% mean that if the bird has regurgitation or proventricular dilation, it doesn't tell us 100% that coronavirus is the responsible agent. It could be an asymptomatic carrier with a different cause of GI signs. So it doesn't stop us from continuing testing. We still have to rule out other things. As far as anti-ganglioside antibody, that is another thing that avian vets are kind of hotly debating, and we don't all agree. There is a lab that offers it, a veterinary molecular diagnostic lab out of Ohio, but there is not yet enough proof that it occurs in and only in affected birds. So it's still one of those things that some people, they're gonna like hang their hat on it, and other people are like, nah. I'm one of the meh people, so I don't really think AGA means anything. But in 5 years, who knows? We might change our mind. So as far as treatment options, NSAIDs are still our mainstay of treatment. They reduce inflammation, and again, we know that the lesions with this disease are inflammatory. It's not just killing the virus, because we can't really kill the virus. We're reducing the inflammation that the virus causes in nervous tissue. So some of the most common ones are Celebrex, meloxicam, and relatively new but becoming more and more accepted is Onsior, which is an NSAID initially prescribed for cats. And one of the things I really like about it is that we can give it by injection. So in a bird that's regurgitating and not keeping food down, and it's hard to give things by mouth, that works really well. So as far as Celebrex versus meloxicam for oral options, Celebrex is more specific to specific types of anti-inflammatory receptors than meloxicam is, but the downside is Celebrex has to be compounded. So in that sense, we can't start it right away. We usually have to call it into a compounding pharmacy. It may be more expensive. Meloxicam is something that most people in the veterinary field have on their shelf. So a lot of people start on meloxicam just because it's there. And personally, I don't find much difference between meloxicam and celecoxib. Again, just my personal experience. So if it's a bird we're going to treat orally, I still reach for meloxicam. But like I said, I'm really liking Onsior and have started to shift much more towards that, either for birds that will come into the hospital for injections or even training owners to give those injections at home, because it's really not as hard as it sounds. So there are more options though than just NSAIDs. So we can use supportive care for their GI signs, metoclopramide and cisapride, which are prokinetics, like they help the gut contract and move things along. Carafate, which is a medication we often use to treat things like GI ulcers, but it coats and soothes ulcerations in the GI tract. So if we have kind of ulcer-like lesions, even in the esophagus, just from repeated regurgitation, that can make a big difference. In these birds, sometimes we're actually treating reproductive signs, which sounds like it's totally unrelated. But I do see a lot of these avian ganglioneuritis birds that are kind of in remission, and then all of a sudden, when they become reproductively stimulated, they relapse. So we do know that reproductive stressors can exacerbate clinical signs. So if we have a bird that is kind of showing signs of becoming hormonal, things like feather picking, masturbation, egg laying, prolapsing, all of those fun things, then I'm usually going to treat them with a GnRH agonist like Lupron or Deslorelin. Use of Deslorelin, I should say, in basically anything except a ferret, because that is all it is licensed for in the US, is controversial. And a lot of vets will not do it because technically we are really not supposed to. That doesn't mean that some vets don't, because it's one of the only things we have available for treating reproductive disease. But just be aware that some veterinarians will not be willing to place a Deslorelin implant in any parrot species, anything that is not a ferret. Cyclosporin is another relatively new thing that we're trying for avian ganglioneuritis. It's an immune suppressant. So in birds that aren't responsive to meloxicam or other anti-inflammatories, then it's a stronger anti-inflammatory, a stronger immune suppressant, but without quite so many side effects as things like prednisone. Because generally we are very wary of using steroids in birds because they can have a lot of side effects. Gabapentin, I really like as well. Um, it was initially developed as an anti-seizure medication, and then we figured out it works well for pain too. So this one works great for birds that are having those seizures or weakness or also neuropathic pain. So this one I tend to add on in a lot of my cases, even with an NSAID, because I feel like it works really well. And then antivirals, it'd be great if we had a good antiviral against Bornavirus, but so far they don't seem to work. We really need more research. And as far as a vaccine, we don't have a vaccine yet. We're still trying to figure out one. There was some research going into a vaccine, and they made one, and they thought they had an answer. And then I remember hearing this at a conference several years ago when they tested it, like they gave the vaccine to naive cockatiels and then tested them with Bornavirus. The vaccinated ones actually got more sick and were more likely to die. So again, that kind of raises questions about, is there an immune factor at play and not just that virus kind of causing damage on its own? So vaccine, still don't have one, hopefully working on it, but nothing really on the horizon. So as far as what can we do, our best options are prevention. So quarantining and testing birds that are new to aviaries, especially in a breeding operation or a very large operation. Um, Good hygiene and disinfection. So the virus really doesn't last long in the environment. So if we're really good about cleaning, about removing feces, then it's very unlikely to spread through things like food dishes and cleaning materials and that sort of thing. Positive and negative birds can exist in the same household, and we'll go over a little bit about some precautions, but it doesn't mean that they can't exist in the same home. And clinically healthy positive birds should not be euthanized. Just because a bird is positive for Bornavirus does not mean it ever will develop signs of avian ganglioneuritis. So then the question becomes, should we even test positive birds? And we'll get into that in a couple slides. So this part is more geared to the parrot owner. So signs to look for if you either have a bird that you're unsure of its Bornavirus status or a bird that you know is Bornavirus positive. We want to look for regurgitation, especially of undigested food like whole seeds. You might see, even if you don't see the bird regurgitating, some of them are really sneaky about it. You might see the accumulated debris on the feathers around their beak or on top of their head, because when food does come up, they tend to shake their head back and forth and spray it everywhere. So if their head is really gunky, that can sometimes be a sign that they're regurgitating. passage of undigested food and droppings, so especially these birds on seed diets. Sometimes their droppings look like gooey nutriberries because they're not digesting the food that's passing through. Other times we see weight loss despite a good appetite. They're eating, 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 but because the GI form is a maldigestion disease, they're not absorbing the nutrients from that. It's kind of passing out undigested. So they might be ravenous, but still losing weight. And then another thing we look for, kind of for the non-GI form of the disease, would be sudden onset of neurologic signs in a bird that's never had them before. So seizures, tremors, blindness, or weakness. So one of the things that owners commonly notice is difficulty perching. Like the bird is kind of stumbling. They're trying to grab onto a perch and they don't really quite grab it right, or they fall trying to grab it. Those legs aren't quite listening to what the bird wants them to do. So when we see those signs, those aren't only attributable to bornavirus or avian ganglioneuritis. There are other things that are differential diagnoses or things we want to rule out before we say, is this bird an avian ganglioneuritis case? So one of the most common is lead or other heavy metal toxicity, because that can cause a lot of neurologic signs like weakness, seizures, regurgitation, abnormal droppings, and a lead test is very easy. A lot of that's if they frequently see wildlife, they may have an in-house lead testing machine. We can do kind of rapid point of care tests for lead. But even if the vets don't have something like that in their clinic, it is very easy to send a blood sample to a reference lab to get levels of lead, zinc, mercury, that sort of thing, although lead would be the most common. Gastrointestinal infections can mimic a lot of these signs, and birds with avian ganglioneuritis often have coexisting gastrointestinal infections because the motility problems lead to overgrowth of things like yeast and bacteria. So we know that can cause similar signs, but you may have both. And then cardiovascular disease can cause the heart arrhythmias, can cause leg weakness. So one of the most common forms of cardiovascular disease we see, especially in aging birds, is atherosclerosis or fatty buildup in the arteries. So we know that can cause, because of the increased resistance, can cause enlargement of the heart, which can cause heart failure or heart arrhythmias. Leg weakness can be caused because if those vessels are getting thickened with cholesterol buildup, it's a lot harder for blood to flow through those smaller arteries and capillaries. So getting blood to the extremities, like the tips of the feet, is a lot harder. So they can get leg weakness or sometimes what we call intermittent claudication, where their legs sort of tense up, especially when they're stressed. And then even with things like seizures, it's sometimes really hard to tell if a bird is having a seizure or what we call a syncopal event. So a syncopal event is basically passing out, but from issues with the heart and not the brain. If the heart is not supplying the body and the brain with the blood and oxygen it needs, then they could briefly lose consciousness, and that's a syncopal event, but not a seizure. Reproductive disease can mimic a lot of these signs too. So if the testicles or the ovary is enlarged or infected, that can put pressure on the sciatic nerve, because where the kidneys and gonads are located, kind of right in the lower back part of the bird, near the pelvis, is right where the branches of the sciatic nerve kind of exit the pelvis and go down the legs. So if we have enlargement of any of those organs, then that can cause the leg weakness that we see. And if we have a large space occupying effect in the coelom, so a really big testicular or ovarian mass, then because of that compression within the coelom, we can see GI signs just because of that. Like if there's something else big in the belly taking up space, it's going to be a lot harder for the GI tract to move around it. And then one of our last rule outs is things like cancer. If we have a tumor in the GI tract, that can cause pretty much all of the GI signs that we would see with bornavirus or avian ganglioneuritis. So at the vet, if you have a bird that you are worried is showing some of these signs and you take it to the vet, things your vet might recommend, definitely x-rays, probably with contrast like barium, because in birds, they are, these big bony boxes that don't really show a lot on x-rays because all of their organs are superimposed on each other. So barium really helps light up the GI tract so we can see it better. And then we can also get some information on what we call GI transit time. How fast is that material moving through the gut? Because if it's not moving as fast as it should, that tells us that there may be a motility issue. PCR for bornavirus is still very common. We can do it on a choanal cloacal swab, so basically the mouth and the butt. We can do it on blood, or ideally, we can do it on both so that we're more likely to catch that virus, whether it's shedding or not shedding. A fecal gram stain is something that's important, plus or minus a fecal flotation for parasites. Parasites are really not common in this country in parrots. They're not generally housed outside. They're pretty much all captive bred, so there aren't really a lot of wild sources for parasites, but some are possible, Giardia being one of them. And a fecal gram stain is important, especially in our smaller birds like budgies and cockatiels, to rule out things like avian gastric yeast, which can cause a lot of similar signs to proventricular dilatation syndrome. And then generally, we're going to get baseline blood work, even though there's not a lot of blood work change we really see with this disease. We want to get a sense of general health. Could there be something totally different going on? And if we're going to put this bird on medications, potentially, like NSAIDs, we want to know that the liver and kidneys are functioning well enough to tolerate those medications. So, personally, I find x-rays are the most useful, but only for the GI signs. If you've got blindness or seizures, you might not see anything on your x-rays. So the other presentations are a little trickier, and sometimes they require a diagnosis by exclusion. So basically, like testing for everything else, not finding any answers, and saying, okay, well, let's treat for bornavirus and see if it gets better. So we can't exactly biopsy the brain in an alive bird. So what do we do if we have a Borna positive bird? Um, if the bird's not showing any symptoms, then nothing really. You can have positive and negative birds in the same house. Because we still don't know everything about transmission, it's ideal to have them in separate rooms, like not in the same direct airspace, but the transmission risk is still very low if they don't have direct contact with each other. We still want to be smart and maintain things like separate bowls and toys and cleaning items and food prep items so we're not cross-contaminating. Like if we go and snuggle with our bornavirus positive bird, we want to wash our hands before we go touch our negative bird. But it's not as though you have to get rid of a Borna positive bird if you have negative birds. And as we've seen, even if your bornavirus negative bird acquires bornavirus, that doesn't necessarily mean they're ever going to have any clinical signs of disease. So as far as disinfecting items, if you're in a household where you don't want to have cross-contamination, first and most important, we want to wash them, just regular warm soapy water, because if we spray disinfectants on a big pile of poop, we're not really doing much. So you want to get all that food and droppings off. And then most common disinfectants really easily kill bornavirus. It's not very stable in the environment. So things like dilute bleach or Clorox wipes, or if you're in like a medical setting, quat, we call it quaternary ammonium compounds. But if your bornavirus bird has walked across the counter and then, a couple hours later, your bornavirus negative bird walks there, the chance of them acquiring it from the environment is very low. We can never say zero, but very low. So the question of to test or not to test, should healthy birds be tested for bornavirus? And this is one of those questions that you'll ask 5 different vets and get, 5 different answers. Or I guess only 2 different answers because the answers are yes or no. But my opinion is no. Many positive birds won't ever develop symptoms of disease. So if we know they're bornavirus positive, then we're kind of just causing ourselves unnecessary stress, being unnecessarily vigilant or worried when this bird may be a completely asymptomatic carrier and may have been that way for years. We can also have a false negative if we swab the bird with a PCR and the bird just isn't shedding virus at that time. Because even if they have the virus in their bloodstream, in their tissues, it's not always coming out of their respiratory secretions, feces. So even if we do a swab, we might not catch it if it's not there. So for the greatest chance of detection, if we really want to do a PCR and know for sure, ideally we should collect swabs over 3 consecutive days and test in that period to see if one of those is positive, then bornavirus is there. Still doesn't mean it's ever going to cause disease, but it's a little bit more sensitive than just doing a single swab. So I wanted to leave a lot of time for questions. So I know we blew through that really quickly. But I want to open it up for questions now. So I'm going to open the chat a little bit bigger so I can actually see it. So yes, one of the first questions we saw was transferring in a home where birds don't come in contact. Would transmission happen easily? And I think as we've seen, the answer really is no. If they have direct contact, especially with wounds or things like that, then we may be more likely to spread. But if they are housed in different rooms or even different cages and they don't have direct contact, then it's pretty low risk of transmission. But yes, as we saw, as Amy said, a lot of vets still do test healthy birds, and it causes unnecessary stress because then vets wonder, do I have to, you know, completely Clorox bleach bomb this room before any other birds go in it? Should I not allow this bird to board in our facility? Do we have to, only handle, like, have one employee handle the coronavirus positive birds and not handle any of the negative birds? Not all birds are even tested, so we're probably handling a lot more positive birds than we ever know. But it's not really a useful screening test for healthy birds. Um, so feel free to open it up to other questions if you'd like. Hopefully there will be some. Or if anyone has specific cases that have happened to them of birds that they've had diagnosed with coronavirus and want to share any details and ask for input, then I'd be happy to do that as well.
Okay, thank you very much for the talk. If you'd like to stop screen sharing, it'll probably make it a little bit easier for people to come on camera to ask questions. And anybody who wants, go ahead and unmute yourself, put yourself back on camera if you want to. You can put questions in the chat, or you can also, if you want, raise your hand or just start talking. If a lot of people start talking once, I'll have you raise your hand, but go ahead, unmute, put questions in chat.
I see a good question in the chat about diet suggestions. So that's actually a very good question. If a bird is clinical for the GI form, then oftentimes we want to feed them a highly digestible diet, like something they really don't have to work hard to break down. So some people put these birds on like weaning diets, like powdered reconstituted replacements, or commercial formulations like omnivore care, like Emirade's product. So if they're really having trouble breaking down larger food items, then sometimes, yes, a very simple, bare bones elemental diet can be a lot easier for them to digest. And yeah, I see another question about, being on NSAIDs for years that caused internal bleeding. That is absolutely a risk. Some of the more common side effects of NSAIDs are kidney damage and stomach ulceration or GI ulceration. We see those side effects a lot more in dogs and cats than we do in birds. Birds seem much more tolerant of those medications, but that doesn't mean those side effects are unheard of, especially with a bird that already has an illness that's causing some GI compromise and motility issues. So, yes, monitoring those droppings really closely for any either frank blood, like red blood, or melena, like that black tarry digested blood, is really important in birds on NSAIDs. And then, yes, I see that question about could they test positive one time and then later test negative? Definitely. And it doesn't necessarily mean the virus went dormant. It just means they're not shedding it at that time. Like the virus sheds intermittently. It may not always be coming out in those secretions. So if they were ever positive, it definitely or most likely means that the virus is there, even if they test negative later. But again, doesn't mean it's ever going to cause signs. And then I saw a note about from Nicole about popcorn and kiwi. Popcorn's been doing great. Oh, that's amazing. Okay, good. So anyway, just personal info. Is there ever a time that you expect to see a positive bird start to show symptoms of any type? Is it true that there is never a false positive? So it's never impossible to have a false positive. Every test that we run, whether it's PCR, serology, biopsy, has some allowance for sensitivity and specificity. How sensitive is it? How likely is it to pick up a positive? How specific is it? How likely is it that when we get a positive, it's actually the thing we're looking for? So there is no test in existence that's 100, 100. There's always a little bit of allowance for error. So yes, if a bird tests positive, that doesn't 100% mean that they're positive. Like 99% most likely it means they're positive, but doesn't necessarily. And as far as when or what is there a time you'd ever expect them to show symptoms? It's kind of anyone's guess. They may never show symptoms. I find that stressful times are times where sometimes we see it flare up or kind of show itself if it wasn't there before. So breeding, moving households, introduction of a new bird that might cause stress, anything that's stressing the bird and weakening its immune system may be more likely to cause expression of the disease.
I have to ask, are we any closer to developing tests that show the difference between acute and past disease, the same way we have IgM and IgGs that will indicate?
Unfortunately, not right now. In a lot of other species, we have some combined tests for things like C-reactive protein and antibodies, like proteins that show inflammation. but we don't really have a similar test for coronavirus right now. So yeah, if we're testing antibodies, it shows exposure, but not necessarily illness. And if we're testing PCR, it shows presence of the virus, but not necessarily illness. So we really don't have great tests for it yet, which is why sometimes we're doing a lot of tests and kind of seeing, how many things are checking the coronavirus AGY or AG categories and how many things are not, and then kind of making a general assessment of whether we think this bird truly has avian ganglioneuritis or not.
Yeah, that's the problem. I get a lot of comments from people who say their bird tested positive, so the vet said therefore they have disease, and they're not doing enough of what you explained, which is to look. The bird
Look
has
for everything else.
something wrong, and they have positive ABN does not mean those two things are related. And unfortunately, I see a lot of, particularly non-avian vets or vets who don't see a lot of birds, who are falling into that false idea that that is the cause of the bird's illness.
Hmm. Yeah.
Bonnie, you have your hand raised?
What is it?
Yeah, I just wanted to make a comment that I have two birds that were tested over 15 years ago as positive, and they're going strong today.
No clinical signs of illness at all.
None at all. And one is this cockatiel that I think he's into his 30s,
Wow.
and he's doing
Yeah, that just
wonderful.
goes
We've
to
stopped
show
doing
that
a lot of testing on him because we don't want to stress him for
exactly
anything at
repeated
all.
blood draws and stuff on a bird that size can be stressful, and even going back and forth to the vet. We want to keep them healthy and keep them
Hmm.
up to date and everything. But yes, there does reach a point where is the stress more harmful than what we want to
Hmm.
provide as medical care.
Yeah.
So I
So
saw,
he goes to the vet, but it's just a overview.
yeah, we don't want to do
Wait,
x-rays and blood work every single time in a bird that
no,
is, yeah, a
won't
little
draw
frail to
anymore.
begin with. So I saw a question about, yeah, the My Dog panel, which I do like. It is good at picking up lots of things. So not just picking up coronavirus if it's there, but picking up other bacteria and viruses and things like that. But yeah, if it showed a positive result, is there a concern of recurrence? Like, again, we don't really know. Knowing it's there, knowing there's antibodies doesn't really help us that much. It's just part of the kind of whole picture that we try to get on the bird to decide whether it's there or not. And then I see a note of a male eclectus that was diagnosed in January, come back a lot, but his legs are still really weak, ends up laying on his perches most of the time. Yeah, so for those birds, obviously we want to have them on kind of our typical avian ganglioneuritis treatments, which usually for a bird of the kind of musculoskeletal presentation, it's going to be an NSAID. And then I like gabapentin a lot for these guys, again, for that kind of neuromuscular pain twitching control. One thing we can do also is, again, question whether coronavirus is the sole cause of that disease or if there could be something else going on too. So a bird with weakness in the feet, I also think of atherosclerosis. So considering possibly looking at the heart or vascular systems as contributors to that disease could be useful. And then again, some birds improve somewhat and then plateau even with the best care. So if that's kind of as good as he got, it's possible that he'll keep getting better. It's possible that will be it. It's possible that he'll decline again. We don't really have great ways of predicting that right now, unfortunately.
Before we continue in chat, I just want to make sure we get Bonnie, who has her hand raised.
Thank
Bonnie.
you. Yeah. Hi, thank you. He was diagnosed a couple weeks ago. I dealt with a teal with chronic illness for over 12 years. So this is very, very triggering to get a diagnosis. He was in pain with his feet. So we've done the x-rays, we've done the blood work. He was put on GABA 3 times a day. And then once we had the diagnosis, put on Celebrex once a day. I'm currently in consideration of, we're going to do heavy metal testing. And in 3 weeks, he's going to go because of checking his kidneys and stuff with the NSAIDs. But he's going to get heavy metal tested. We're considering the CT scan as well as the barium, which I guess my understanding is they cannot be done probably on the same day.
Right, because the barium is contrast that's going to show up on that CT and maybe change things. Plus, it's a lot for a bird to go through in one day. The CT generally requires anesthesia. X-rays, we usually use at least a little sedation, but I don't like to fully anesthetize them because we're looking for motility, and if we give too many drugs to slow that down, then we're altering our results.
Right. I guess so I'm trying to figure out which is the next test, but also, because I think the more you know, the better off you're going to be long term. But, I had to take him down to the GABA twice a day because I was almost out of it, unfortunately, with holiday week. He is syringe trained, but
Oh, that's great.
right now he's not taking the syringe at all. He runs away from it. It is compounded, good flavors. He's not taking it on his treats. He's not even like, and I'm like, I do a lot of behavioral work with him. I've worked with behaviorists. We're members of Parrot Kindergarten, so I'm very, very much into force free. And I don't even know what medication's getting into him at this point, and kind of feeling like, is it like do everything I can to get it in him, and if he doesn't get it in him, he's in pain, or do I like have to restrain at this point? And because he seems like when he's better medicated, he's stepping up, and when he's not medicated enough. So I know that's a lot. I'm just still very, very triggered. It's a lot.
Yeah.
It's
No,
a
those are very valid concerns, and it's things we go over a lot with people, especially when it's a bird that can't be handled. Like the owner is not interacting with the bird enough that it's hand tame, and maybe it's a macaw that the owner is completely terrified of because it was passed down from their grandmother. You know, that
Yeah.
those things happen a lot. So there is always a balance between treating their disease to the best of our ability and considering the quality of life of bird and owner, because we have to consider the human animal bond. And if medicating them helps them feel better, but destroys the human animal bond, then that's not ideal. But if they're miserable without medication, is it worth stressing them to medicate them? Or is that a point where their disease affects their quality of life enough that we would consider things like euthanasia? There are no right or wrong answers to that. That's where it really comes down to each owner specifically deciding kind of what lengths they want to go to or what their bird benefits enough from that it's worth the stress or pain of doing this. So your concerns are very valid. Unfortunately, there is no black and white answer. It's very bird and owner dependent.
Is it like if he has gabapentin twice in one day and the next day he's not taking it, is it like kind of like for naught? I mean, is
No,
it
it's short acting, so it's not one that like has to build up in their system to have an effect. So it's very quickly metabolized. That's why we usually give it so frequently, like 3 times a day. But it's one of those that it's working for a period of time after you give it, and then it's out of their system. So it's not as though it has to be, if you miss doses, you're not harming them in the future. They just went that amount of time without medication effects.
okay? Thank you very much.
You're welcome.
Okay, we have a bunch of questions in the chat.
Yes. So let's see. Similarities, conclusions about
I think
lymphohistiocyte.
Nancy's comment about the male eclectus, that was that's
Where
where we
was that one? Oh,
after Corey's question.
mm-hmm.
Mind-
So yes, we answered the one about the eclectus, I think, right? And looking for things like heart disease. And then for similarities, conclusions about lymphohistiocytic polioencephalomyelitis and lymphosplasmacytic ganglioneuritis, and frequently significance of the flora body. I think they mean antibodies on necropsy. So unfortunately, I'm not as familiar with the first disease process that they're mentioning, the lymphohistiocytic polioencephalomyelitis. So I can't necessarily comment on similarities, conclusions between the two. But as far as presence of antibodies on necropsy, those usually are pretty significant. So if we're taking histopathology of tissues like brain, spine, liver, pancreas, GI tract, and we see that we call perivascular cuffing, and we can do things like virus isolation to kind of grow the virus from those tissues, or special stains to identify the virus. If we see those things on necropsy, that tells us pretty definitively that it was there and it was causing disease. And then Lee commented, do hormones become less of a factor as a bird ages? And unfortunately, birds don't have menopause. They do not go through a period of senescence. Their hormone production does not taper off later in life. So unfortunately, we don't have that to look forward to. So hormones can flare up at any point in life, whether a bird is 5 or 70. So that's, I know, annoying, but I have had one macaw that the owners thought it was a boy for very many years and then laid his first egg at 40. So yeah, hormones, we love them, we hate them, but they can happen at any time. And then Michelle said, I have one with it, but tested negative for viruses. And that says very hard to test for. The virus isn't stable outside the host. So that is true. It could be a false negative where the bird was tested and the test said negative, but the virus is there and the test just missed it. Or it could be one of those cases where the virus isn't there and maybe there is something else that we still do not know causing that immune system stimulation that's resulting in ganglioneuritis signs. So if, like, my feeling is if it walks like a duck and quacks like a duck, we're going to treat it like a duck. Even if it's negative for bornavirus, if it is showing all of the consistent ganglioneuritis signs, then I'm probably going to treat it in that way. And then I saw Lee saying, yeah, he gets the implant, and it definitely helps, but it's, yeah, hormonal issues are unfortunately something we are always struggling with and don't have an easy cure for. So I'm going kind of back and forth between Lee and Michelle. But for Michelle, I saw, yes, she said we did the barium test. And yeah, Lillian commented that her Triton possibly has atherosclerosis because she'll fall off her perch from time to time, and the vet put her on isoxaprine, but this is totally different, correct? Yes and no. So atherosclerosis, which causes that weakness in the feet that responds to things like isoxaprine, and bornavirus avian ganglioneuritis are two separate diseases, but they can exist in the same bird and they can have similar signs. So leg weakness can be caused by ganglioneuritis, can also be caused by atherosclerosis. So if it's not getting better on isoxaprine, then yes, looking into avian ganglioneuritis as a potential other factor could be something that you consider. And then Michelle said they use banana muffins for the medication. And I think that's perfect. If anything, they'll get the bird to eat it without an argument. It's worth it. I mean, even things like peanut butter, like it's not something I usually recommend feeding birds, but I've never seen like an African gray that'll turn down peanut butter, even though it's like the worst thing for them. So like mixing it in a spoon with a tiny bit of peanut butter and feeding it to them that way. I think that yes, we want to feed our bird good diets, but we also want to manage the disease that's making it hard for them to get calories in. So we're always weighing the pros and cons, and I think giving them junk food to get the meds in is the lesser of the two evils. And then I
And
see number
this
here.
is Lori. I've actually used almond butter without the sugar and added salt
Mm-hmm.
because I figured that may be a little healthier than the peanut
Yeah.
butter.
Mm-hmm. Or even things like mushed up banana for some birds that really like that. If you have a big enough bird, like a macaw, like raspberries work well because they have kind of a built-in hole and you can like fill the raspberry with the medication and then feed it to them and it tends to like mush all into the raspberry juice. Smaller birds are a little trickier. And then someone commented, said, just a comment here. I've been having an avian nightmare here for at least the past dozen years. I lost 4 black palm cockatoos to PDD. Wow. They had genotype 5, which is not one of the more common ones. 2 and 4 are the more common. How many people actually know their genotype? Probably not many, because we are not routinely genotyping them. That's something that's more done at like a university research level. So as far as like just a regular kind of commercial veterinarian, we're not genotyping them. It said 2 pairs of major vessels and 2 pairs of rosies in the same room with them for at least 10 years. Some tested positive for ABV, some didn't, but they've all remained seemingly healthy. And yes, that is very possible. There's also difference in species sensitivity. So some of the more, like, unfortunately rare and exotic birds that haven't been captively bred for as long, I find tend to be more susceptible to it because maybe in captive breeding and lower levels of exposure, maybe we're breeding hardier birds. Whereas things like black palm cockatoos that aren't bred very frequently and are less common may have less resistance to PDD. But yes, the other birds in the room may be positive, may be negative, but they may never develop disease or they may. Unfortunately, we don't really have great ways of predicting that. And then I saw Myra comment that her conure was great for meds. But yeah, had to go through a couple of flavors of the meloxicam. Tiny piece of bread soaked in meds worked for me. Something I often recommend for like cockatiels or things that like crunchy food but not mushy food is Cheerios. If you can like saturate a Cheerio with the medication, that can work well. But every bird is different. You've got to like pick the food that they like and see if there's something like consistently. And then sometimes they get wise to it and don't want to eat that food anymore. So you have to find their next favorite treat and switch it around. Organic unsweetened fruit juice, that works well too. So yeah, and there's more than one way to skin a cat. If you find something the bird will eat, the medication in it, great. My feeling is even if it's junk food, as long as it's not toxic, if they'll eat it in coffee, that I might have a problem with. But if it's something that's non-toxic and just a little junk foody, it's probably still better that they're getting the meds and controlling their disease. I can't see everyone to see if there are any hands up or not. But if anyone has any other questions, feel free to put them in the chat.
We did have some. Lori, did you want to talk?
Sure. So back in 2016, I had a pair of bonded Quakers,
Mm-hmm.
and the one developed, got very wobbly, couldn't walk, broke her foot. The vet had it wrapped. It should have healed. Well, she got worse. So the vet thought perhaps it was PDD.
Mm-hmm.
So put her on the medications. Actually, I don't even think she did the blood work at that time. She just did the medications.
Mm-hmm.
And this was in February. Hope died in June. It went very quickly. We did the necropsy. That's what it was.
Mm-hmm.
Now, Hope she had a bonded friend. Kiwi seemed very healthy. 4 years later, she started she pulled her feathers out under her wing and like chewed through her skin.
Yeah, the axillary dermatitis or the ulcerative dermatitis is a really, unfortunately, common and very difficult disease to manage because that wing is so stretchy that it's like every time they flap their wings, they're ripping those lesions open. So that can be one of the hardest areas of like self-mutilation or infectious skin diseases to manage.
Well, and she got so bad that we ended up having to euthanize her, and she tested positive too with the, we did the necropsy.
Mm-hmm.
Then
I'd be curious to see if they found the virus not just like in her, spine, gut tissues, but if they found it like in the nerves supplying the wing. I don't know if you got that far, but it would just be curious to know
I'll have
like
to go
if it
back
was
and
there.
yeah.
And they may not have tested every single nerve in the body, but it would just be like I said, a point of curiosity to see if those areas specifically had more evidence of like perivascular cuffing or viral damage.
And so I understand because those two, they were a bonded pair. They were feeding each other. They lived together for a while. But at the same time, I had a conure and young bird. We went in for routine blood work. And it was during COVID. The vet called me. I was out in the car. The bird had a heart attack and died during the blood draw.
No.
Now we did a necropsy there. Again, tested positive for the PDD.
I mean, I find that the arrhythmias associated with PDD, in my experience, I haven't seen a lot of sudden death with them. Now, that doesn't mean that can't happen because any sign of any illness in a bird can be sudden death, let's be honest. But I find I notice it when I put them under anesthesia, like if we're doing something like getting a sample with an anesthetized bird, taking x-rays, when we listen to their heart, all of a sudden it gets very slow, and that's where we're like, stop, wake them up. Like, that's not okay. And it happens more with the Bornavirus birds than not. I have had birds that have, passed away in my hands during blood draws. I've had one that I never even touched that just came in for wellness exam and died in its carrier before I even looked at it. So I don't, I can't blame myself for that one. But the long and short of it is that yes, traumatic, sudden events can happen. It doesn't necessarily mean Bornavirus was the cause, but if they found it in heart tissue, then I would say it's much more likely to be responsible as opposed to if they just found it in the brain or in the GI tract or that sort of thing.
Because the necropsy from UConn came back that's what the bird died of.
Okay.
So I had 3 other birds at the time. They were all tested. They all tested positive, and they're we're on Celebrex or Meloxicam, but they're all fine now and they're not showing any symptoms.
And they may never, or they may in 10 years show symptoms.
So-
Unfortunately, we don't have a great way of predicting that. And that's what we really need, is not so much a test for picking up virus antibodies or virus itself. We need some predictive test of, okay, what is the likelihood that this animal is going to develop illness from the disease? And unfortunately, we really don't have that yet.
Yeah.
We don't even really have a test that gives us prognosis. Because again, some birds develop signs and very quickly progress. Like I've seen these guys go from bad to worse in like a couple
Yeah.
months. And
That's
others,
like that's what Hope did. She went very quickly. And
And
yet
others
I've
have
got
stayed
these other
stable for
guys
years.
and they seem
Mhm.
fine.
Yeah. Like I have one mini macaw that's been on meloxicam since the bird was, pretty sure we diagnosed it when the bird was 2, and the bird
Okay.
is 10 now. And it's been on meloxicam for 8 years, and it's never had any other flare-ups.
Right.
And we always wonder if we should just take it off meloxicam, but we're like too scared because we don't want it to get sick again.
I was just
Blood
going
work
to
is always
say that. I'm
fine.
wondering that too, but I'm too afraid because I've got too many macaws and
And
They-
again, it's like you never know what's the right answer. Hindsight's 2020.
Yeah.
If the bird gets an ulcer, we're gonna wish we took it off. And if we take it off and the bird develops signs that we can't get back under control, we're gonna wish we kept it on. You know, we never really
Okay.
know, and we have to. I always tell people we have to make the best decision we can with the information we have at the time, and then give ourselves grace if it wasn't the right decision later on.
But that brings up another question. So Dr. Schunk, the mini macaw you're referring to actually had a flare of disease, right?
Yes.
But Lori, did any of your birds actually, the ones now, did any of them actually show disease, or they just had positive tests?
Jerusha had very watery poop.
Mhm.
Now that's gotten somewhat better, but it's still pretty watery. Billy has plucked like crazy, and he's gotten, he's like really naked now.
Mhm.
So
Yeah.
Dr. Sinclair was thinking, we did the test, so maybe those symptoms were part of the Borna and the PDD.
And that's what's so tricky, is there are so many things that avian ganglioneuritis can do, and all of those things have other differential diagnoses as well.
Yeah.
So when do we attribute it to ganglioneuritis versus when do we say, no, it's just a positive bird that has signs unrelated due to something else?
Right.
We don't really know. We're all
Yeah.
kind of just taking our best guess and treating the birds as best we can. I would say if they're doing well and their symptoms are relatively well controlled or you haven't seen any progression, personally, I would keep them on NSAIDs. I don't see a lot of NSAID complications in birds. That doesn't mean zero, and some birds can have very serious complications, but in general, their risk of complications is lower than in mammals. So I tend to be a little bit more pro medication if they're doing well, as long as they're
okay.
closely monitored.
Yeah, that's the problem. Is feather plucking is so.
Oh yeah, that can be
We could do like 5 lectures just on feather picking.
right, exactly.
Right, but anywhere from 30 to 40% of birds test positive for Bornavirus in general, when they do studies on completely healthy birds. So with that higher rate of positivity, it's hard to really attribute anything specifically to that.
Right.
And I think I just answered my question.
Yeah, I think you did.
And I think you may have just answered Nancy's question. What's the life expectancy? Who knows?
Who knows?
Exactly.
Yeah.
And anywhere between 2 months and 50 years. Like, it depends how sick they are and how fast it goes. I find we generally get a good idea in the first few months of treatment. Like, are they going to respond and become stable? Or are they one of those birds that, like, we try every treatment under the sun and they're just not getting better? Like, how they do in those first 2 or 3 months, I think tells us a lot about whether this is a bird that's going to crash and burn or whether we're going to get it under control and it's going to have a relatively normal life afterwards.
Yeah, it makes a lot of sense.
Yeah, I stopped worrying about them. I'm, when I first got that diagnosis with the rest of them, I was, panicking, but they're fine. So we're doing the best we can with them.
And that's all you can do,
Right, and their symptoms may not even be due to it. So
Right.
yeah, interesting. I want to circle back a minute to the contagiousness issue.
Yeah.
we know that there are different genotypes. Are certain genotypes more likely to be contagious or more severe than others? Equivalent to, say, hepatitis C in humans, where certain genotypes are a lot worse than others.
So that's a good question because some of the studies didn't specify genotype. So again, we know that 2 and 4 are the most prevalent, but as far as which ones are the most virulent, I do believe there have been some studies on which ones cause the worst disease. I don't remember off the top of my head, but as far as which ones are the most transmissible or contagious, I don't believe that's been studied yet. So, I
That
mean, I could do a literature search and see if I'm wrong, but to my knowledge, the kind of communicableness of the genotypes hasn't been studied, at least not that I've been aware of.
Right, right. And in terms of housing birds together or not, you'd mentioned about housing separately, but if you had one budgie that was positive and one that was negative, and you're not even sure if the diseases do that, would it be okay to house them together or let them feed together? Or it's slow
Right.
risk.
And that's one of those things where, like I can never tell you what to do. I can tell you what increases risk and what doesn't, but not, oh, this isn't okay. You could have those budgies together for their whole lives and they could never transmit it, or through regurgitating back and forth, especially if they get like a little laceration in their mouth or on their toe or something, sure, they could transmit it. And then if they do transmit it, are they going to be birds that never actually get symptoms from it? It's it's all about, for me, kind of communicating levels of risk to an owner, and then the owner can make a decision about what level of risk they tolerate in their home. So it's an educated decision. Like, I don't necessarily say you can't do that, you shouldn't do that. I say, like, this increases risk, and this is what might happen if you do that. This is and this is the risk benefit. And then with that information, you can make an informed decision about what you want to do in your household.
Right. I was thinking specifically of popcorn kiwi, and
Mhm.
Nicole popped in and
Yeah.
say, you test kiwi periodically to see if she contracts it?
Personally, like, I wouldn't, because let's say kiwi's positive and then never develops signs. Like, if
Right.
kiwi developed clinical signs like regurgitation or lameness or blindness or something like that, then I would say, yes, let's test for Bornavirus. Because knowing that she's positive wouldn't change anything about how I treat her unless she's showing clinical signs,
Right.
you know?
All right. And then Lee has a question there right above Nicole's post.
Let's see. Bird gone to remission, the flare right back up. On zero works where uncertainty comes off. Um, it comes off the onset, she keep taking the Celebrex. So personally, I feel like some birds respond better to one NSAID than another. So like if they don't respond to Metacam, I'll try Celebrex or Onsior. I don't like flip-flopping between the NSAIDs personally, because in dogs and cats, we know that mixing those NSAIDs can greatly increase our likelihood of side effects. Birds process things a lot faster, so that risk is probably lower, but it likely still increases that risk. So if the bird does well on Onsior, then the way I usually manage that is getting them on the lowest effective dose and frequency. So Onsior, we can use that, depending on the paper you read, anywhere between 2 milligrams per kilogram and 10 milligrams per kilogram. And we can use it anywhere from 3 to 4 times a week to every day to once a month. So like if it's having a flare up, I would probably treat it with Onsior like maybe twice a week at one of the higher doses. And then as it gets better, I would pull that back to a lower dose or lower frequency to try and keep it in remission. And then if it flares up again, increasing the dose and seeing if that helps. So that doesn't mean that's the right answer. That's just how I personally would manage a bird like that.
Myra has a very good question there about anti-ulcer meds.
Yes. So, and that kind of boils down to how easy is it to medicate your bird? Because yes, we can put them on things like famotidine and carafate, which sometimes we do anyway, just for managing those GI signs. But if it's a bird that's really difficult to medicate, then it's like pick your battles. Do we want to struggle to get even the NSAID into the bird, and then it's a bigger fight for the other meds and the bird hates you? Or is it a bird that pretty readily takes medications, and then yes, we want to protect it against all of the kind of presentations of this disease as we can? So I don't always put them on GI protectants. if they develop clinical signs of GI ulcers, like blood in regurgitation or blood in droppings, then I absolutely do. But it's not something I always do proactively, just because making the decision to medicate a bird already is adding so much stress. Making the decision to medicate them with 3 medications 2 or 3 times a day, now we're adding a lot of stress. And then let's see, regarding providing meds such as Celebrex to resistant birds, some members of our AG group have been offering Celebrex chews, compounded flavors, Texas, which at blank, not medicated, choose a number of flavors. Yeah, so that is a good point, because some people automatically assume that if it's a bird, you have to do liquid. But a couple compounding pharmacies do like I think one of them does like mini melts, some do, yeah, like soft chews. And as long as the bird likes it and there's nothing in them that's toxic, which if it's safe for dogs and cats, then generally it's something that's not going to be toxic to birds. Then yeah, if they take that like a cookie and that's easier than giving them liquids, that is absolutely something that you can do. Whatever gets the meds into the bird with the least stress.
Yeah, I guess I would just hope that they will eat the whole chew.
Yeah. And it sounds like this pharmacy will give you kind of a blank chew to do a test run, which is great to see if they actually like it. But this is also another reason why I like Onsior, because then it's not like 2 or 3 times a day every day. It's like maybe once a week or twice a month or something like that. And you catch the bird, you give it injection, boop, it's done. Like, yeah, it's not going to like that per se, but half the time if you get the towel over them, they're not even looking at you and they don't remember in 2 minutes, you know? It's a little different than kind of fighting with them and shoving a syringe in their face.
Right, right. Good point. Good point. All right. Do we have any more questions? Oh, we have a comment again, a bit from
Let's see, let me slide down.
yeah.
I
Yeah,
think-
the 4 palms I lost at PDD genotype 5. 3 of them suddenly had a seizure and either died from the seizure immediately or a few days later. 4th one I lost had gastrointestinal problems before losing her. Necropsy showed the disease to be in the brain. Oof, that's
No.
Horrible.
It's really sad, but unfortunately, some of them, like birds with many diseases, show no clinical signs until a life-threatening complication occurs. And those are some of the most frustrating because we don't have any time to kind of like prepare for that or cope with it. We have to cope after the fact, after we find out what happened. But it can be really challenging to deal with that sudden loss and not knowing what happened and not having any time to kind of prepare yourself for the loss of a pet.
yeah, that's why I was wondering if certain genotypes might either be more transmissible or might affect certain areas more, or
I do believe certain genotypes are are associated with different forms of the disease. Not always, but I feel like some I don't want to like make things up, but I recall hearing that some of the genotypes are more likely to cause some forms of disease than others. I don't know about transmissibility. That's something I haven't heard of yet, which doesn't mean it's not researched and not true, just not something I've been aware of. And then Michelle asked, is the shot easier on the digestive tract? To some extent, yes. To some extent, no. So it's not contacting the gut, and in that sense, it is a little easier on the GI tract. But the way that NSAIDs affect the GI tract is not just by contact. It actually decreases production of prostaglandins, which are protective in the stomach and the intestine. So even if we're giving the shot, we're still systemically affecting those organs and decreasing kind of the stomach and gut's ability to protect itself. So
right.
the risk is still there, even with Onsior. Because hers had the internal bleeding, yeah. And if we catch the internal bleeding early, then we can stop the NSAID, get them on gastroprotectants, recover from that immediate insult, and then hopefully get them back on an appropriate medication. But it's when we don't catch them right away, or if they have a very sudden and severe bleed, that those can be life-threatening.
This is the one that had it.
Aw, super
And
cute.
he literally, his red blood count was down to 11.
Wow. So then he survived it though.
And he came home and they said, take him. I said, should I continue to medicate him? And they said, no. And they said, sorry,
That's okay.
and they just had, they said, just prepare.
Mhm.
And we literally prepared no medicine and 3 days later, his stool looked better and he was acting like a different boy. So right now, we're still trying to get his red blood cell count up. It's like up to 21 now.
Oh, great. And so for blood loss, which can cause iron deficiency anemia, because they're losing so much blood, they don't have enough iron to make more hemoglobin fast enough. Sometimes we'll put them on iron supplements to help. But the comment you made about him losing a lot of blood and doing okay actually takes me back to a study that was done on chickens, because most bird studies are initially done on chickens, about how much blood loss can a bird tolerate. And the amount of blood that they can lose compared to a mammal, like as a percentage of their body weight, is huge. So in these birds, they kind of studied, okay, if we take 10%, if we take 20%, if they take 30, how long does it take them to recover? With sub-Q fluids to replace the fluid loss, they got up to 60% of blood volume that they were able to take from a chicken and have it recover totally fine without treatment. So
Wow.
more than half of its blood, which is, I think, pretty crazy. And yes, these guys aren't chickens, and hopefully we're not taking out more than half of their blood. But the point is they can handle amazing degrees of blood loss, more so than we would think, and be totally fine. Still scary when it happens.
That would kill a human, so that's pretty
Oh,
impressive.
yes.
Okay, do we have any more questions or comments before we wrap up? Either in chat or to come on camera.
I love the birds in the audience too.
Yeah, actually, we usually have more birds in the audience. I didn't even bring over any of mine, so, but I think
I would
this.
bring over mine, but she would just scream at all of you, so.
I'd
Favorite
love
hobby.
to see your little Quaker.
I can get her if you want, but she's probably gonna scream at you guys.
This is
They're
bird.
always my favorite.
Now, her favorite hobbies are screaming at everyone that walks into the room and trying to bite the cats if she's walking around on the floor.
Sounds like a Quaker.
Yeah, because as you can see from that last picture on the question slide, I don't know if you saw it, but that is my, I'll share it again so you can see. But that is Cilantro, my Quaker, standing on one of my cats, Kiwi. So, yeah, she runs the house. The cats are just, her pets. So, as always, I tell people, never cats and birds unsupervised. They can do serious damage, et cetera, et cetera. But there have definitely been bird to cat bites, and I have never had a cat to bird bite from my family, at least.
It's funny how all Quakers seem to be named after green foods, more than other green parrots. But there's something about Quakers that they always get named after green foods.
Yep.
Because she was almost parsley, and then she ended up as cilantro.
There we go. All righty. So if there are no more questions, I want to thank everyone for coming. I want to especially thank Dr. Schunk for taking her time out of her busy schedule to give us this talk. It was obviously very popular. I think this is the largest number of people we've had attend a meeting, and I have quite a few requests for the video already. And the video will get posted to our YouTube channel. If you didn't get notice about the meeting directly from me, but you asked for a link through our email, I will make sure to send you the video link directly. Also, you can just look for our YouTube channel and find it there, but that will be posted within the next few days. I am going to stop the recording now.